Hi, welcome back to Health Impact Live and Digital Health Talks 5 Good Things segment. I'm Megan Antonelli, joined as always by Janae Sharp, founder of the Sharp Index. Each month, we pull together the stories that show where digital health is actually moving the needle, not the hype cycle, the real work. And this month, the through line is clear. Digital health is growing up. Patients are already living it. Health systems are getting serious about deployment, and the workforce story underneath all of it is finally getting the attention it deserves. 5 stories, 1 conversation. Let's get into it. Hi, Janae.
Hello, how are you?
I'm good.
Let's just say I proposed this month that the good thing could just be my birthday and we'd be done, but we did the work and found other good things for everyone.
Happy birthday.
Thank you. I'm old. So
yes. It was also Mother's Day. You should have picked a better day to be born.
I know. I've always had a hard time with Mother's Day, but this year someone showed up at my house with her kids and did yard work.
That's amazing.
And this is the power of friendship. When you have great mom friends, they just remember you, and I love that.
That is amazing. Well, that is wonderful to hear, and I'm sure she took care of you on your birthday too.
Yeah.
But there were some other good things that happened besides your birthday this year.
It's true. There were some other good things this month. Let's talk about them. What do you think is your number one thing?
Well, I did see a study, and I think this speaks to a lot of our, just a lot of the things we talk about every day in terms of the 71% of U.S. adults are using health-related apps. I think it came out of... Where did it come out of?
Here's Healthcare shared that.
Yeah. But the study, I think it was a Reach 3 study.
Okay.
That it was. And, I think we talk about how that's happening and we see it in terms of who's using what and how that's, has the potential to create some certainly disruption in the healthcare system, but it gives people more accountability. And I think it was 71% using health-related apps and then 64% using health-related devices. And then even more broadly, 88% of consumers wanting the same or more technology in their lives. So around healthcare. So I think the desire is there, and it is up to the system to give it more. And then kind of on the flip side of that, or maybe parallel to that, the American Hospital Association and West Health launched a 3-year program, a $12 million accelerator to help hospitals operationalize digital tools. So sort of those 2 things were my first and favorite sort of good thing in digital health this month, for sure.
Yeah. And I think that's amazing. When I was looking at that accelerator, it looks like health systems can look at their maturity and their adoption and kind of see best practice and see where other people are at. When you make it a contest, suddenly these people are all going to have access.
Mm-hmm. And we just benchmark in healthcare, don't we? Benchmarking, but that comparison helps and creates that incentive around deployment and adoption for sure.
Yeah, I'm always for more convenience and more coverage. Even though ideally we'd all be able to access the healthcare we need really easily in the way we want. That's not totally reality, but I think we're getting there. Like, we're really working on expanding access and making the technology infrastructure as good as it can be.
Yeah, no, absolutely.
Let's talk about another good thing. Now, we love to talk about AI, artificial intelligence, specifically about ambient and how it impacts clinicians, how it impacts care. So we did find some information from Becker's. They shared about how ambient AI adoption is exceeding our expectations. Mm-hmm. And there was great news from Boston Children's that they are cutting neurosurgery wait times for their patients while they saw a 60% increase in demand. So I love that.
Yeah, I think that the ambient piece was interesting. I think the way that they framed the conversation was, there's good news about ambient, and it's not what you think it's going to be. And I think it is all around kind of physician adoption and, the interest that the ED docs in particular, and that both these stories were from Boston Children's, in fact, I think. And so it was like 150 ED clinicians using Scribes Monthly, and how, enthusiastic they were about the ambient technology. And it's being driven by those physicians, and the reliability and the workflow is really coming, the feedback is incredibly positive. And then on that other side, Boston Children's had, sort of different tools, obviously not ambient, around cutting new patient waits and increasing visits, reduced cancellation, patient ease of use scheduling, just a number of real workflow optimization and improvements using AI. And I think we've been hearing so much about the money being spent on some of these technologies and the search for the return on investment and where they're seeing it. And I think now we're getting to that place where the value is quantifiable, right? It's not just, maybe hours back, or, sort of vague discussions about pajama time and burnout reduction, but real things that health systems are able to quantify and report. And I certainly, we had a big month in terms of travel and going to the Digital Health Innovation Summit in Boston. We actually saw John Brown's team from Boston Children's and a number of other folks at that event who were talking about just that, which is where these technologies are really meeting, starting to deliver. Yes. Dan Shields from Auctioneer was talking about it. UPMC was there, more on their payer side, but talking a lot about revenue cycle and so.
It's nice to see too. One of the major metrics that I think people should look at is clinician adoption. And Stanford Health announced that their adoption was higher than what they projected. It's at 48%, their adoption, and people like it. So,
right.
While you were there in Boston, I used Caregility, who is not a sponsor of this podcast, but could be, to go to the doctor. And it was fantastic. It was so fast. And I didn't have to take everyone in my life there. So it was amazing. We talk about all these things, and then when you see them in your real life, you're like, oh, that actually was more invisible than I thought it would be.
Right. Yeah, no, it is. I mean, I think we talked so much. I mean, I think when we started HealthIMPACT, it was about, adoption and struggling with adoption. Physician adoption of EHR was, impossible to achieve at, years and years and years ago, back when we were children. And
back last week.
Yeah. But now to see a technology that people are really adopting, quickly and liking it, is refreshing, right? And so, and then actually being able to measure, real positive outcomes from it is great. And of course, there are a number of tools and platforms. But you mentioned Caregility, coming out of the American Telemedicine Association, ATA Nexus conference in Orlando. They were there. There were a number of those types of companies there talking about what they're doing around virtual care. And it's really nice to see that sort of community mature, right? I've gone to that conference for probably, 6 years now, and it is a little bit smaller, but just so focused on, the practice of virtual health and virtual care and care everywhere, both in, in specialty hospitals and inside the hospital, outside the hospital, at home. There's so many places that care is going to be and is being provided. So that brings us to good thing.
Good thing. I think that is really important. I mean, a while ago, a lot of things we were talking about are broadband access, and healthcare delivery systems are seeing this as a critical part of their infrastructure, not just having buildings, but also having that ability to deliver virtual care to everyone within multiple states. So our next good thing is about that, because Ascension announced their virtual care layer.
Mm-hmm. Yeah, I think they talked about just launching their virtual care infrastructure across 9 states. I think 110 hospitals and 2,000 care sites. And it's connecting not just clinicians and patients, and it also is EHR agnostic, but it supports teleneurology, telepsychology, infectious disease, and, same day virtual care. So, I know, certainly I use it quite a bit with my kids, and, they've got a sore throat, and they've got, an ear infection, and kind of the easy things, but they're definitely getting into more levels of care and more types of care, and across those different states. And so that's, and to be able to do that seamlessly, not dependent on that EHR is huge, given the number of hospitals and health systems that they own. And of course, when you get into these specialty care systems, they often don't run on the same platforms and all of that. So
exactly, yeah,
it improves your, it goes back to, which of course was a huge topic of conversation in terms of the rural transformation initiatives. And, what the original promise of telemedicine was in the first place, which is getting to rural and underserved communities. The technology is now there. And to some degree, the revenue model is now there for these larger health systems to be able to support that and support it well, and make the investments required.
Right. So I love the idea, too, that telepsychiatry neurologists will be able to help patients across different states and different electronic health systems without a million logins, because not everybody has the same record system. And making it more convenient for everyone is critical, I think.
Yeah, it was amazing actually at at ATA Nexus. I met Dr. Lindsay Garby, who I'll be interviewing on the show in a few weeks. But she is the founder of Blueberry Pediatrics, and she talked about how she is licensed in 50 states, which blew my mind. And I also was.
That's expensive. Yeah.
Yeah, I was basically told that lots of virtual doctors do this because it just means that they can work for a certain platform. She has a number of doctors on staff at Blueberry Pediatrics that are, licensed in 50 states. And the woman we were with, she was also licensed in 40 states, and she has a menopause virtual practice. So many, or women's health virtual practice. This is happening. And so our fourth good thing is around UVA, actually. UVA Health has launched an on-demand virtual primary care. I know I've heard recently that Sunny Sapra was just moved over there, which is exciting to see. Hopefully we can get him on the show soon to talk about this. But I think the program is really to, address these gaps and the shortages, with clinicians. And, UVA is sort of in the middle of Virginia. It's not, so it's certainly in rural areas. So to connect these, patients with nurse practitioners and physician assistants for, just the common conditions, common things, preventative care, chronic disease management. And I guess they've launched it May 20th or May 12th, and they're already up to 30 appointments a day because the demand is so high for this, particularly, again, with the pediatrics and behavioral health. And, it's dependent on a triage system. They route patients to in-person care when they need labs and imaging and procedures. But, the fact is that people want this. It just makes life so much easier. I emailed my physician today and said, can I avoid coming in for Owen? He had already been in March, and I don't want him to have to miss school. It's just simple things. And that was the biggest thing that I walked away from at the Digital Health Innovation Summit. Dan Shields from Ochsner said on the stage, not all healthcare belongs in the hospital, and the more we can put the level of care that doesn't belong in the hospital outside of the hospital, the more we free up beds for critical access, which is what matters and what's important. And frankly, a better revenue model for the health system, right? They're not to be taking care of, fevers and ear infections and, even little things. So it's
not every health question or health issue has to be an in-person visit. I like that they've used virtual visits as a way to improve access for critically ill patients and to do chronic disease management, which I think if you have a chronic condition, you don't necessarily want to go into the hospital all the time or your doctor. So it's right sizing the platform that people are using.
It's the right care at the right time in the right place, which,
right.
More often than not can be at home or, at a different type of care facility that is not a hospital, right?
Right. And that takes us to, we're talking a lot about access and we're talking about shortages. We know we have national shortages, and this brings us to our last good thing, kind of a tongue-in-cheek good thing. We frequently talk about regulatory changes. And right now, I want to say one of my good things is that 25 states have sued about the graduate healthcare loan limits. And it was a coalition of states in the District of Columbia that sued the U.S. Department of Education over their new graduate student loan restrictions. And you might have seen stuff about that recently. I think of the American Nursing Association, American Psychiatric Association. A lot of healthcare organizations came out to speak against some of those changes that had happened, like saying nursing wasn't a professional degree. And some of the important thing that people might not realize is really that designation influences the percentage on your student loan. So instead of getting your federal loan for 3%, you're going to get a private loan for 7 to 12%. And it's a major cash grab for people who are funding education privately. Now, I think it's great that they're fighting back and that they're suing about it.
Right. And I think that is the biggest thing. And it's, this discussion or that change has been in the works for a bit. And it's just now, I think, because it's like a July deadline that change is going to come into place, which of course is when people are applying to get their loans to go to graduate school next year. And this, in fact, it impacts nurses, physician assistants, physical therapists, MPH, a ton of healthcare degrees that are, that power the healthcare system and certainly are what we're looking at for, increasing access and improving, primary care practice through, across the continuum. So when the news covered it the first time, you hear that and you think, oh, that's terrible. But I think your point, which I'm going to reiterate just in case anyone doesn't get it, is that it is a cash grab. Right? I didn't realize that. I just thought they were doing stupid stuff because they sometimes do stupid things.
Oh, I assumed it was so they're making some of this move that the government isn't subsidizing the things so that they can make more money. Like a lot of the changes that are made in education are being made by people who have a financial interest in privatization. So right. It's also interesting that when you look at the caps, there are new caps. It used to be $50,000 annually or a total of $200,000. Now it's $20,500 and a total of $100,000. And they might position it as, oh, we're fighting against the cost, but that's not what's happening.
Right.
When the average
cost of education has gone down.
Yeah, when the amount of debt is $216,000 on average for medical school alone, you realize that people are already, if they have to pay for it with loans, which many do not, but many do as well, they're going to have to pay it back at a higher rate. It's also a little bit problematic, I think, because that means people who don't have, $100,000 laying around, they won't be able to do it. So it's a way to decrease economic mobility.
Mm-hmm. Yeah, and decrease diversity and decrease, the number of people that are able to access these programs, 100%. Right. So the good thing there, just in case you missed how we snuck this in, because we just wanted to talk about it, is that states are suing the Department of Education over these graduate student loan restrictions. So hopefully, and, for whatever we can do to support this case.
Hopefully nobody disrespects nurses like this ever again. We love to see people standing up for for medical professionals.
Yes. But so in that, and I think, I love when we tell a story and that there's an arc, the digital health is, the transformation is happening. It's here. Our patients want it and physicians want it. Physicians are happy with the technologies for the most part we're providing. There's, of course, as always, there's some trepidation, some concerns, and we have to keep those guardrails in place and make sure we are putting more and more guardrails to ensure that these tools and technologies are providing better care and higher quality care and improving access. And yes, to some degree, the importance of increasing the workforce. None of these technologies are meant to reduce the amount of nurse practitioners, nurses, doctors, clinicians. We're meant to improve the care of those that exist and improve the access and ability of the people who want to get to them, because there is a crisis in this country. So, right. Kudos to those states who have sued the U.S. Department of Education. And, I sure hope they win.
Yes. So that was our 5 good things. We have lots of other good things, and we're always happy to talk about it. There's that thread of digital health, from pilots to operating models, from infrastructure to need. And we love sharing the stories of people who are doing the real work right now, and the ones that we want to keep pushing. I also want to say we love our audience, and we love it when you share our good things. So we want to congratulate John Lynn. His son graduated from college, and another one of his sons graduated from middle school. So, and his daughter's graduating high school. Can you imagine 3 graduations like that? But he commented that, so we had to give a shout out, because we want everyone to share their good news with us. Whenever you see us posted, make sure you're sharing it, tagging it. Let us know.
That is quite a remarkable and busy May and June he is going to have after. And I want to thank John Lynn. We didn't talk about Sway Health this episode, but it was certainly one of the best things that I attended this month. And, great group of people, unbelievable organization that they've done, and just such a community that they've built around the healthcare IT marketing folks. So stay tuned. I do have so much, I learned so much that I'm just still processing it to kind of get it out there. But it was a great thing. And John is a great friend and supporter of of Health Impact. So it's been good for him for having.
We love that community.
How many graduations to attend, which does bring us to the fact that Health Impact, in case you have not seen, the Health Impact Forum is not going to be in June, because we are avoiding all of those graduations and the FIFA World Cup this year, and moving our event to October 6th and 7th in New York at Microsoft, which we are so excited about. If you are interested in being there are very few sponsorship spots left over. So get in touch very soon, and we will get you there. We are so excited to be back at Microsoft this fall. And with that,
so make sure to register for that. Make sure to share every single video, subscribe to Digital Health Talks on YouTube, on every podcast platform, and you can also find us at healthimpactlive.com.
Yes. This is Megan Antonelli, CEO of Health Impact Live, and Janae Sharp of the Sharp Index, and this is Digital Health Talks. Let's keep fixing healthcare one conversation at a time.